One time when I was early in my practice, this woman came to my office because she had some extra skin on her upper eyelid and she wanted an upper blepharoplasty. She was a nice woman and the surgery went flawlessly. I was super happy with how it went. She didn't have much bruising afterwards, came in for her follow-up visits afterwards, and she looked at me and she said, "You're a nice doctor, but you get a B-." I was speechless. My first thought was, is that a good grade? Are you one of those like school teachers where you start with a C and anything above that has to be something exceptional, so maybe a B- is a good grade? As things started to sink in, I realized that B- was not a good grade. In fact, what she was telling me in her very calm, pleasant manner is that my surgical results sucked. And this patient taught me more than any textbook could ever have taught me about how the eyelid and the brow interact. In this video, I'm going to tell you why, and why it's important to understand whether a brow procedure is needed to fix a heavy or hooded eyelid. So, if you're new to our channel, my name is Dr. Eftekhari, and I'm an oculofacial plastic surgeon. If you want to learn more about eyelid surgery, please feel free to subscribe to our channel. So it's important to understand that if you feel like your eyelids are heavy or hooded, that there might be a couple of things going on. It's not just the skin. It might be the skin, but it's also possible that it's the outer part of your brow that's causing that eyelid to fall. If you don't understand that before surgery, you might be wasting your time getting just an upper eyelid lift. And in this video, I'll tell you why. So, whenever I see a patient in my office and they're coming in for an upper blepharoplasty, the first thing I do is I look at the framing of how their eyebrows sit. Are their eyebrows straight across? Are they arched and pulled up at the outer corners? Or more commonly, are they hooded and kind of pushing down at the outer corners, where as you go past the halfway point of the eyebrow, it just kind of slopes downwards. And that sloping downwards can influence where the eyelid skin sits. The reason for that is very anatomical. So we have a muscle that lifts our forehead. That muscle goes from about here to here. Once you get from about here on outward, there's no more muscle that lifts the forehead. It's just fascial tissue. So if we have a lifetime of squinting, raising your forehead, making facial expressions, that can wear away at that fascia over here and pull it down. And that's what can cause pushing down of that brow onto the upper eyelid skin and further push the upper eyelid skin down. So let's say you just have this problem, but you're like, yeah, forget it. I'm just gonna get the skin removed. What can happen is when the surgeon removes the skin, if there's a lot of laxity to that eyebrow, what's gonna happen afterwards is that it's just going to pull the eyebrow down even further, and you're still going to have that hooding on the outer part. You might have no extra skin here, but you'll have a ton of hooding here, and it'll look very asymmetric. And that is why my patient gave me a B-, because I didn't carefully think about how she needed a brow lift, but I was too nice to tell her. And in reality, I did an upper blepharoplasty when she needed both a brow lift and an upper blepharoplasty. So whenever I see a patient in the office, there's kind of two things that I look at to test to see if they need or might benefit from a brow procedure. So the first thing I do is I look and I observe how that extra skin fold goes across. Does it go straight across and then kind of pick back up as it gets back out to the brow? Or more commonly, if that extra hooding on the upper eyelid skin kind of swoops down and causes a crease or an overfolding of the tissue outside the eyelashes as you go towards the temple, that's when I know that the brow is causing some of that appearance. And just removing upper eyelid skin is not going to address the skin over here. The reason is you can't make your cut go out that far. If you go and make your cut way past the eyelashes out to here, you will have an unacceptable scar after surgery. So you have to lift that from above. Second test I do is I actually grab that extra skin and I pull it down because I want to see how much laxity there is here. If I pull that skin down and things bounce right back up, well then I might not necessarily need to do a brow procedure because that fascial tissue has pretty good tone to it. It hasn't stretched much. If in contrast I pull that tissue down and it just comes right with me and pulls the eyelid down, then I'm talking about a brow procedure, because you have to stabilize the eyebrow in order to get the result you want with the skin. An analogy for this would be like if you had a window curtain. If the curtain pole is kind of curving downwards, then the fabric is all going to be sitting on the ground by the time the curtain at its lowest point. So you have to kind of straighten the pole on the curtain in order for the fabric to sit with the proper amount of tension and be able to be adjustable in your window. So think about the eyebrow as the pole and the eyelid skin as that fabric. That's why it's so important when you go to your eyelid surgeon to ask, do I just need the skin removed, or is there a part of this that is my brow that's hanging down? Because the last thing I want for you is to give your surgeon a B- after surgery. If you'd like to learn more about eyelid surgery, check out our other videos or check out our website, eyelidcenterutah.com.